Let's think about your body for a second. Inside, there's this constant, delicate balancing act going on, and one of the real stars of that show is calcium. Now, it's not just about bones, it's a mineral that has to be kept in perfect equilibrium, kind of like a seesaw. If it tips too far one way or the other, things can start to go, well, a little haywire. So, I've got a question for you. What one mineral basically acts as your body's on off switch for everything from your heartbeat to your reflexes? Well, if you guessed calcium, you are absolutely right. It's the key that literally controls the electrical signals in all of our most vital systems. And here's why. Yeah, we all know calcium is crucial for bone strength, but that's just the beginning. It is absolutely essential for your heart to contract and for your nerves to function. I love the term the source material uses for these excitable tissues. That's your heart, your muscles, your nerves, all the parts of you that need to fire up on command. Now, get a load of how incredibly narrow this healthy range is. Your body is working around the clock to keep your blood calcium level somewhere between 8.2 and 10.2 milligrams per deciliter. That is the perfect balance point for our seesaw. It is a tiny, tiny window, and staying inside it is absolutely critical. Okay, so here's our game plan. First, we'll talk more about this balancing act. Then we'll dive into what happens when calcium runs low and what happens when it overflows. After that, we'll look at how we diagnose an imbalance, and finally, how we get things back to normal. So let's start with one side of the imbalance. What happens when that seesaw tips too low? This condition is called hypocalcemia, and you can think of it as our body's on-off switch getting stuck in the on position. So what does too low actually mean? Clinically, hypocalcemia is when your calcium level drops below that 8.2 floor. Now, that might not sound like a huge drop, but remember how narrow that healthy range is. Even a tiny dip is enough to start messing with your body's entire electrical system. So why would this happen? Well, it could be that you're just not absorbing it properly, like with Crohn's disease. Or it could be because of low levels of something called parathyroid hormone, or PTH. Just think of PTH as the manager that tells your bones, hey, release some calcium, we're running low. And that's why thyroid surgery can sometimes be a risk factor. Other causes can be high phosphate levels, which you see in kidney failure, or even lower estrogen levels after menopause. This right here, this gets to the absolute heart of the problem: neuromuscular excitability. What does that mean? Well, basically with too little calcium standing guard at your nerve cells, they become way too easy to trigger. They get hypersensitive, twitchy, overreactive. Imagine a guitar string pulled way too tight. The slightest little touch makes it go wild. That's your nervous system with low calcium. And you see the effects of this overexcited system everywhere. Your gut gets moving too fast, leading to diarrhea and cramping. You get those twitchy, hyperactive reflexes. You can even feel irritable and confused. But the most dangerous part? It's what it does to the heart. The electrical system can become unstable, leading to really dangerous arrhythmias and low blood pressure. So how do doctors spot this? There's a pretty classic test they can do called Trousseau's sign. They just inflate a blood pressure cuff on your arm, and if your hand and wrist involuntarily spasm up into this kind of claw-like position, that's a dead giveaway of that underlying nerve excitability from low calcium. All right, let's tip the seesaw all the way to the other side. What happens when there's way too much calcium? This is called hypercalcemia, and it's like someone poured sludge into the gears of your body, slowing everything way down. So for hypercalcemia, we're generally talking about a calcium level that climbs above 11 milligrams per deciliter. And as you can imagine, tipping the seesaw this far in the other direction comes with its own whole set of serious problems. What causes this kind of overflow? Sometimes it's as simple as taking in too much calcium or vitamin D. Other times it's that same parathyroid gland, but now it's in overdrive, pumping out way too much PTH. Certain cancers can also cause it by breaking down bone and releasing all its stored up calcium. And just like with low calcium, kidney failure and even certain medications can be the culprits. And here we have the perfect mirror image of the last condition. Where low calcium caused everything to be overexcited, high calcium does the exact opposite. It's a depressant. It slows the whole system down. And the symptoms are exactly what you'd expect from a system that's slowing to a crawl. The GI system slows down, leading to constipation. You feel muscle weakness. Your heart rate can actually decrease. And all that extra calcium has to go somewhere, right? Well, it often ends up forming painful kidney stones. And make no mistake, if this sluggishness isn't addressed, it can become life-threatening. The muscle weakness can get so bad it leads to respiratory failure.
The effects on the heart can cause heart failure or fatal arrhythmias. So, the big takeaway here is that both extremes of this seesaw are incredibly dangerous.
Okay, so we've got these two totally opposite sets of symptoms. How do doctors actually pinpoint the problem and figure out if the seesaw is too high or too low?
Well, it really comes down to a few key tools. First and foremost is the serum calcium test. That gives you the definitive number. Next up is an ECG, which can show really characteristic changes in the heart's electrical signals. And finally, checking that parathyroid hormone level gives a massive clue about what's causing the whole mess in the first place.
All right, once the diagnosis is in, it's time for the most important step, getting that seesaw back to level. And it probably won't surprise you that the treatments for these two conditions are, logically, polar opposites. The core strategy is actually pretty simple. For hypocalcemia, where you don't have enough calcium, the goal is to put it back. For hypercalcemia, where you have way too much, the goal is to get it out. Simple as that. So for low calcium, this means giving calcium either by mouth or through an IV, often with vitamin D, because that helps the body absorb it. On the flip side, for high calcium, it's all about flushing it out of the system with IV fluids and diuretics, and sometimes using medications to stop the bones from releasing anymore. Now, I want to end on a really crucial point here. While both of these conditions are serious, severe hypocalcemia, that's low calcium, is considered a true medical emergency. That overexcited state can lead to seizures or even cause the airway to spasm so quickly that you need immediate IV calcium to stabilize things. So, to wrap this all up, let's come back to our seesaw. The most important thing to remember is that keeping calcium balanced in that tiny, narrow window isn't just about having strong bones. It's about the fundamental rhythm of your heart, the firing of your nerves. It's about the function of your entire body. And that leaves me with one final thought. This whole delicate calcium balance is just one piece of the puzzle. It's one of hundreds of invisible balancing acts happening inside you every single second. Kind of makes you wonder, doesn't it? What other incredible things are going on in there right now to keep the whole show running?